Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. Laser hair removal. It got approved from US FDA in 1995, very recently, 30 years back. Why someone wants to get rid of their hair? Because hair at unwanted areas is a common and distressing aesthetic problem for both men and women seeking for its removal. Laser hair reduction has become one of the most popular cosmetic procedure. What is the difference between the word cosmetic and aesthetic? Both are related to beauty and can hence be used interchangeably. If any procedure is addressing any health issue, it is called therapeutic procedure. If it is addressing any issues related to beauty, it is either called a cosmetic procedure or aesthetic procedure. Now coming to laser hair removal, why it became one of the most popular cosmetic procedures? Because of advantages of permanent hair reduction. What is meant by permanent hair reduction? It is just the reduction in the number of hair from the pre-existing density, not like complete removal of hair. There is no guarantee that hair won't regrow also. Minimal or no downtime, which means immediately after the procedure one can go and continue their daily routine. No need to take rest, no discomfort, no complications, quick coverage of large body area. Hence it became one of the most popular cosmetic procedure. The pigment melanin in hair. Melanin is not evenly distributed throughout the hair. It is present only in outer root sheath, shaft and bulb of hair, which is used as a chromophore in laser hair removal. If the type of melanin is pheomelanin, it is present in skin type 1 to 3, which will give the color red and blonde color to hair. This hair is called light hair. If the type of melanin is eumelanin, which is present in skin type 4 to 6, it will give the hair black and brown color, which is called dark hair. For light hair, we'll use Alexandrite laser. For dark hair, we'll use diode and Nd:YAG laser. Remember, for laser hair removal, we will use AD and ND. AD for Alexandrite diode, ND for Nd:YAG. If the hair doesn't contain any melanin, no melanin, then hair will be white and grey in color. No laser will work. Common sense. If we don't have any target chromophore, that is melanin, we can't destroy the target hair. So no lasers will work for white and grey hair. Lasers target dark hair well and hair in early anagen phase because of more melanin. Percentage of anagen hair in scalp is 85%. In beard it is 70, upper lip 65, axilla and pubis 30, arms and leg 20%. See here, because of this percentage, we need more number of sessions. For females, except over scalp, remaining all the areas of the body, presence of hair will be irritating and distressing. It is opposite for the boys. Boys who doesn't have beard and mustache will exactly feel like this. Why all my friends of my age are getting beard and mustache and they are showing off? Why I haven't got yet? So from this we can clearly know that females will seek for hair removal over the body most often, except for hair over scalp. Remember, telogen duration decides the interval between each session. That's it. No need to remember all these numbers. I already told you. Here we can clearly see anagen hair percentage is less than 100%. So a single session won't work. Multiple sessions are needed with interval decided by telogen duration. Coming to indications, hypertrichosis, hirsutism, hidradenitis suppurativa, triple H. Boys may feel nostalgic after hearing this word triple H. Pilonidal sinus and pseudofolliculitis barbae pubis. Coming to contraindications specific to laser hair removal. General contraindications will be same for any laser. Coming to specific contraindications, waxing, tanning, tweezing and electrolysis, we have to wait at least for a month and then only we have to proceed for laser. Bleaching and depilatory cream usage, we have to wait for 15 days. Why we will use bleaching and depilatory creams? Bleaching is to detan. If one is tanned, we have to wait. That's why here waiting period is 15 days. Deep chemical peels and dermabrasions. These are all relative contraindications. We have to wait some time until recovery of the inflammation because of chemical peels or dermabrasion. Then only we have to proceed for laser. Pre-procedure workup is same for any laser. Here we will assess type of skin and hair color, coarseness and density. In laser tattoo, remember, we have assessed tattoo type of ink, amount of ink, depth of ink. Here, hair color, coarseness, density. Except apart from this, medical history, neoplasm ruling out, prior laser treatments, written informed consent, pre-treatment photographs, prophylactic acyclovir, providing wavelength specific protective eyewear to everyone present in the room, and surgical mask. Everything is same for any laser. Coming to laser hair removal, we have to first shave the hair, then remove any jewelry, topical eutectic mixture of local anesthesia if needed. Cleanse the skin with a non-alcohol wipe, cover tattoo or any permanent makeup and keep the tip of the probe 1 inch away to avoid full thickness burns over tattoo. If near the treatment area, if there is any tattoo, be careful to cover it and keep the probe 1 inch away from the tattoo. Don't do laser over the tattoo because there may be risk of full thickness burns over tattoo. Because in laser hair removal, we will keep pulse width more than the thermal relaxation time. Why? We will see in some time. Apply clear, colorless cooling gel prior to treatment to protect epidermis. After treatment, it is called post-treatment cooling, either with cooling gel or ice pack, whatever, to reduce post-inflammatory hyperpigmentation. How? If there is any excess heat, this cooling effect will remove the heat and prevent collateral damage and further inflammation. Coming to technique, hold the handpiece perpendicular to skin, ensuring the entire tip in contact with skin firmly. In laser tattoo removal, we will keep the probe at some distance, not touching the skin. 20% overlap is allowed. In laser tattoo removal, just 10% is allowed. Here 20% is allowed. Why? To avoid skipping areas which may lead to stripes of hair regrowth. After 1 to 2 weeks, to prevent this, we are allowing 20% overlap without leaving any area in between. Perform single pulse, that is nothing but test spot. We'll select small area and we'll perform single pulse and look for any clinical endpoints like singed hair or singed hair smell, hair extrusion, that is hair coming out of the follicle. This hair extrusion will be there until 1 to 2 weeks after the treatment. Perifollicular erythema or just erythema over skin. If there is no endpoints, we will increase the fluence. By doing so, we will know what is the optimum fluence to keep and several other laser parameters which are of paramount importance for a successful treatment. After selecting these optimum parameters, we will do the entire treating area. First test spot is important. For light hair, we will keep fluence high. For dark hair, we'll use fluence low. Just remember the fluence, remaining all other parameters will be exactly opposite, that is inversely proportional. Pulse width short, wavelength small, spot size less. Pulse width long, wavelength big, spot size more. Simple concept, fluence is inversely proportional to wavelength and spot size. If wavelength is large or big, there will be more depth of penetration. If spot size is more, there will be more depth of penetration. Exactly opposite, if fluence is high, less depth of penetration. The three most important parameters I have star marked here: pulse width, duration of pulse; fluence, energy delivered per unit area; wavelength, specific chromophore. Coming to frequency, more repetition rate will allow quick movement of hands and the treating time will be very less. We can complete the treatment very fast. Number of sessions required are 5 to 7 with gap between each session over face 1 to 1.5 months, upper body 2 to 2.5 months, lower body 3 months. I have already told you this gap who will decide? Telogen duration will decide. For face 1, upper body 2, lower body 3 months. Face, upper body, lower body 1, 2 and 3 months of gap between each session. For one session there will be only 15 to 30% reduction in hair. Hence, it is obvious that a number of sessions will be required. What if we use aggressive parameters like high fluence? There may be undesired endpoints like graying, whitening and blistering. Laser is nothing but light. If we use high energy, it will cause blisters. Coming to mechanism of action. Principle of selective photothermolysis. What we are selecting? Chromophore. What is that chromophore? Melanin. What is thermal relaxation time? TRT. Time taken to dissipate 63% of its peak temperature by target chromophore. Based on this thermal relaxation time, we will decide the pulse width of equal to or less than the thermal relaxation time of chromophore. To specifically target that chromophore, we will keep pulse width equal to or less than the thermal relaxation time. But here, in laser hair removal, we will keep pulse width more than the thermal relaxation time. Why? In laser tattoo removal, why we are keeping same pulse width? Because the target in laser tattoo removal and chromophore is same, that is ink particle. Here in laser hair removal, listen carefully, in laser hair removal, chromophore melanin and the target are not same. They are present at some distance. Hence, pulse width is kept more than the thermal relaxation time of the chromophore melanin in hair to allow heat diffusion towards the target, that is non-pigmented stem cells in bulge. This concept is nothing but thermal damage time. In tattoo removal, just thermal relaxation time concept is enough. But here, extra extended concept of thermal relaxation time, that is nothing but thermal damage time. Listen carefully, three concepts of thermal damage time. Time taken by whole target, both the chromophore and the hair follicle, to dissipate heat by that 63% of its peak temperature. It states that thermal destruction of the target, that is hair, present at a distance from the chromophore, can be achieved by heat diffusion. So, just targeting the chromophore is not enough. The entire target present at a distance, we have to send heat there also via heat diffusion. So, we have to keep pulse width more than the thermal relaxation time. This is proposed as an extended theory of selective photothermolysis, extending the heat not only to the target chromophore towards the actual target. That is nothing but extended theory of selective photothermolysis. For non-uniformly pigmented target, nothing but hair. I already told you in the beginning itself, hair is not uniformly pigmented because melanin is not uniformly distributed and in the entire hair. Concept clear? Both you have to get clear about thermal relaxation time, targeting chromophore, thermal damage time, not only the chromophore, entire the target hair follicle also by a heat diffusion. So common sense, we have to keep pulse width more than the thermal relaxation time of melanin. Coming to complications. What bro, you have told no complications at all in laser hair removal and you have elevated in the intro. I didn't say no complications. I have clearly wrote minimal or no complications. If complication comes, it will be minimal and rare. What are those complications? We will see. General complications are same for any laser. Reactivation of herpes, transient urticaria, milia, blisters, hypo or hyperpigmentation, dermal atrophy, textural changes, scarring, keloid, wound infections or delay in any wounds, healing, post-operative erythema, petechiae, purpura, all these are general complications for any laser. Coming to specific complications of laser hair reduction, it stimulates long fine hair growth and metamorphoses vellus hair to terminal hair. Very rare. Acneiform eruptions, folliculitis, leukotrichia, whether it may be temporary or permanent leukotrichia, pruritus, pain, erythema, edema, burning, urticaria. These are specific to laser hair removal. Coming to post-operative care, erythema and edema will resolve in hours to days. Ice packs and 1% hydrocortisone cream 2 to 3 times per day until it resolves. Usually it will resolve in 4 to 5 days. If the erythema and edema is persisting longer, it indicates there is increased risk of post-inflammatory hyperpigmentation. Obvious sun protection prior to laser priming. After laser also, we have to ask the patient to do sun protection until all the sessions are completed. Why? To reduce the risk of post-inflammatory hyperpigmentation. Singed hair can be wiped off with wet cloth. PCT if needed for 3 days. Remember the channel name TADD. Don't forget to like, share and subscribe. Thank you. Hasta la vista. До свидания.